Hare Krishna. This is Yograj from Bhaktivedanta Hospital and Research Institute. Welcome one and all for the today's podcast on causes and prevention of kidney stones on our live streaming partners Hare Krishna YouTube channel. Bhaktivedanta Hospital and Research Institute is a 300-bedded multi-speciality tertiary care NABH accredited hospital which is located in Mira Road, Mumbai. We offer holistic healthcare services for body, mind, and soul with the advantages of allopathic, Ayurvedic, homeopathy, and alternative medical therapies under one roof. This podcast is under our flagship program titled ISKCON Devotee Healthcare Services, which was launched by Bhaktivedanta Hospital and Research Institute during the ILS, that is, ISKCON Leadership Sangha event, which was held at Mayapur in the year 2023. Till date, through this initiative, we were fortunate to got the opportunity to serve 19,000 devotees approximately, nationally and internationally as well. Today, we will be discussing on the causes and prevention of kidney stone. On this podcast, to address the basics and more in-depth aspects of the topic in a way that will be engaging and informative. Let me introduce to our today's speaker, consultant urologist who gains 20 plus rich years of experience in urology department and who is also a deputy director medical services associated with Bhaktivedanta Hospital, Dr. Siva Prasad Gourabathini, His Grace Shaligram Krishnadas. Hare Krishna Prabhuji.
Hare Krishna Prabhu.
So let's begin and let's talk causes and prevention of kidney stones. Sir, the first question: what are kidney stones and how do they form?
Kidney stones, when we say it is urinary stones, why I'm saying urinary stones, when the urine is filtered in the kidney, it comes down to the ureter into the bladder, and the bladder it gets stored, and then the urine is discharged.
Okay.
So the stones are usually formed in the kidneys, and when they are in the kidneys, they are silent.
Mhm.
And when they come down to the ureter, sometimes they can give pain. And in the bladder also, sometimes stones form because bladder is not working, or there is some infection into the bladder.
Got it.
So stones are some substances which are not supposed to be in the kidney. They
Correct.
get aggregated, and they give some local destruction to the kidneys,
Got it.
and sometimes infection, and sometimes pain.
Got it.
So they are the common causes for the how do they form.
Yes, sir.
Simply, it's a supersaturation of a particular substance.
Got it.
When there is more accumulation of that substance and it settles down, and there are some uh, inhibitors for stone growth, there are
Mhm.
some aggregators for stone growth. So when there is a disbalance between the two,
Correct.
then the stones form.
Okay. Second question is, what are the common types of kidney stones?
The commonest type is made of calcium. This is a common thing people ask,
Mm-hmm.
and people know it also. Every
Yes.
one of us know
Yes.
it's a calcium-based stones. It's a
Mm-hmm.
calcium oxalate
Okay.
and calcium phosphate,
Correct.
and they form about 80 to 85%.
Okay.
The next comes the uric acid stones. That
Yes.
is about another 10%, followed by other miscellaneous stones, true white stones. They're all
Correct.
there.
Right.
The commonest being calcium based. Calcium oxalate is the commonest stone.
Okay. Calcium oxalate.
Yes.
Okay. Okay. Next question is, sir, what are the primary risk factors for developing the kidney stones?
The primary risk factor, I would like to say first, over the last 1 decade, the stone disease incidence and prevalence has gone up by 40%.
Oh.
So, in the health checkup, when we do,
Mm-hmm.
every third sonography picks up some sort of crystal in the sonography,
Got it.
and it is reported as stone.
Mm-hmm.
So now looking at the risk factors per se, um, urinary risk factors. If there is less urine, that means if you're not taken enough fluid, and there is less formation of urine. That's the commonest and the highest risk factor for stones.
Got it.
And of course, apart from that, we have high calcium excretion in the urine,
Mm-hmm.
high oxalate excretion in the urine,
Got it.
high uric acid excretion in the urine, and the beneficial ones like citrate is low in the urine.
Mm-hmm.
So these are some of the substances which make the complex urine to form stones, and
Got it.
there are some other factors also.
Right. Correct. So, do you think like the diet influence is the formation of kidney stones?
Significantly, yes. So the reason why the stones form now is because of the fast food life,
Got it.
and people don't have time to sit and honor the food, and they're in a rush. So food is treated as like a fuel to the car.
Got it.
So that is one of the principal factor.
Mm-hmm.
But looking at the diet as such, um, any of this, the high animal protein,
Mm-hmm.
and people with foods like rich in oxalates
Okay.
and high sodium intake,
Mm-hmm.
there are a couple of the main dietary factors
Got it.
which can
Yeah.
form the stones.
Right. Right. So, majorly the dairy products we can say it is also the source to.
I would differ here
Hmm.
because this is one of the commonest myth.
Yes.
So when we say the calcium and we compare it with the milk,
Yes.
and then we don't want to take milk,
Absolutely.
and that's not true.
Okay.
In fact, milk is protective for stones.
Right.
When we take milk, it binds to the oxalates which are there in the foodstuff in the intestine,
Got it.
and it lowers oxalate
Mhm.
levels because the oxalate get excreted in the stools.
Got it.
That way, there is protection for stones. Also, because you brought up the topic of milk,
Yeah.
the other calcium-based ones,
Hmm.
um, people say it is high risk for the stones.
Got it.
No, not at all.
Okay. So when we talk about so regarding the kidney stones, it's a cry of a stomach, basically. So what are the common symptoms and how to diagnose a kidney stone, and what kind of test or imaging are required to detect if I have a kidney stone?
Well, as I said, commonest presentation nowadays is a silent stone
Yes.
in the health checkup.
Absolutely.
So when it is in the kidney, generally it is silent.
Right.
So when it comes to the mouth of the kidney, which we call as a pelvis,
Mm-hmm.
renal pelvis, it can give some pain,
Got
renal pain.
Yeah.
And when it drops down to the ureter,
Mm-hmm.
it gives a very severe pain, which we
Yes.
generally call as a colic pain.
Got it.
Colic pain means it's an excruciating pain.
Mm-hmm.
It comes and goes, comes and goes.
Got it.
The person requires a analgesic immediately.
Mm-hmm.
So that is one type, and people can present with infections,
Okay.
especially people with a low immunity, like people with the diabetes,
Okay.
elderly people
Mm-hmm.
with multiple comorbidities.
Right. Hypertension.
Yes,
Yes.
hypertension. So it's a part of metabolic syndrome. So they form silent stones. They present with sepsis. Sometimes they come to the even ICUs.
Okay. Got it. So, what are the dietary changes which can help preventing the kidney stones, especially our brahmacharis and sannyasis?
Yes.
Yeah.
Um, I want to add water in the diet.
Of
See,
course.
even the studies have shown that's only liquid that has been proven even scientifically
Mhm.
to prevent stones,
Okay.
prevent recurrence of stones also.
Okay.
So the common question people ask is how much fluids to take,
Yes.
and the books write 2 liters, 3 liters, 4 liters. Generally, what is recommended is
Hmm.
one should look at the urine color.
Urine color. Okay.
So if the urine color is like water,
Mm-hmm.
clear, then you are adequately hydrated.
Okay.
That's enough.
Got
So
it.
we can't calculate on summers, winters, whatever we're doing, it's all quite different.
Right. Right. Correct.
So water being the most important thing.
Mm-hmm.
So with regard to the devotees as such, so
Yes.
we have ekadasis, we have festivals.
Mm-hmm.
Those who have tendency to form stones,
Mm.
it is not at all appropriate to fast from fluids.
Got it.
So very
True.
very important. So especially in our service,
Mm-hmm.
we need to keep our service going by keeping ourselves fit.
Absolutely.
So water is the most important thing to
Got
be
it.
taken.
Right. 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 Absolutely.
The second part of the other dietary things what you mentioned is
Mm-hmm.
milk. So at least a glass of milk, as I said, it protects us from the stones.
Correct.
So milk is the most important to be taken.
That's very important information, so you have given us. So, requesting to check on the bottom of your screen, we have mentioned 24 by 7 dedicated contact number wherein you can reach out to us for your any healthcare needs and queries. Also, the contact information is mentioned to organize such kind of events and podcast for your congregation. Requesting also participants to drop down your queries in the comment section. We can take all those questions in between as well. So the next question is, how often should someone at a risk of kidney stones be evaluated by a healthcare professional?
Right. Somebody has not formed stones, somebody has formed stones.
Hmm.
Somebody has not formed stones with as the age advances, everybody nowadays undergoes sonography, or
Right.
recommended is at least once a year sonography.
Once a year sonography. Okay.
Somebody who's got stones and got it removed in whichever way,
Mm-hmm.
and first sonography should be done at 6 months, then every yearly,
Okay.
and all depends upon the type of stone.
Mm-hmm.
General recurrence rates mentioned is 1 to 2 per year is a growth.
Mm-hmm.
So we are looking at in first year, 10% of them have a recurrence.
Got it.
In about 5 years, 30%.
Mm-hmm.
In about 10 years, 70%.
Right.
So lifetime recurrence risk is always there. So we can never be away from the checkup.
Absolutely. Yes. Yes. At times I have seen in our corporate culture also, sir, we have like a very closed cabinets wherein the function of AC, and of course we are born to have the air conditions in our rooms, so the quench of thirst is also minimized. And once anyone sit on his desk and doing his work, he forgets to take the water itself, the intake. So I think that is also had become less, and one has to take that definitely an information thing to drink the water at least a couple of
Yes, if you look
times.
at that occupational things,
Yeah.
doctors, type A personalities who sit down and work a lot, so they come on the top. It has been
Yes.
statistically proven also.
Absolutely.
So you rightly said yes. Apart from that, there are other occupations
Mm-hmm.
like drivers, like
Yes.
people work in the hot places
Correct.
in the steel industries.
Yeah.
They do have, yes.
Correct. Um, you spoke about the hydration. So, how much water should a person drink daily to prevent the kidney stones?
Yes, as I said, best measure is to look at the urine color.
Urine color. Okay.
So it doesn't need to be water alone.
Mm-hmm.
Any types of liquids which will keep him hydrated.
Got it.
So urine color is the most important thing to monitor.
Got it.
So minimum urine should be at least 1500 ml per person.
Mm-hmm.
So that should be the minimum at least.
Okay. Fine. Uh, are there any specific foods or substances that people with a history of kidney stones should avoid?
Yes. Now, when we look at the types of stones,
Mm-hmm.
the calcium oxalate being the commonest stone.
Got it.
So, as I said, calcium is needed for the body,
Mm-hmm.
and it's oxalate which is a problem. So, we want to take some foods
Mm.
which would reduce the oxalates in the body.
Of course.
So, we need to avoid high oxalate foods like the coffees,
Mm-hmm.
100% coffees,
Okay.
rich coffees,
Mm-hmm.
and leafy teas. If
Okay.
you look at the label, they are quite rich in oxalates.
Right. Right.
And the drumsticks, they are high in oxalates.
Of
So
course.
that needs to be avoided.
Yeah.
And um, any of these nuts which
Mm-hmm.
are there, whatever is in the sweet is enough, but
Mm.
one cannot take and eat.
Right.
See, if you look at that, there is a stone belt in India. All over the world, it is there.
Hmm.
The stone belt, we in Maharashtra now, it is a part of stone belt.
Right.
Maharashtra, Gujarat, Rajasthan, then Haryana, and some part of UP, it comes as a stone belt,
Correct.
and some part of the northeast areas.
Yeah.
So we especially should focus on these most important things.
Correct.
Second part is the preservative foods.
Hmm.
Any of these preservative foods, they disbalance the aggregators and inhibitors in the urinary
Right.
system.
Yes.
So they increase the formation of stones.
Okay.
So all processed foods to be completely avoided.
Got it.
All processed foods.
Correct. Right. So, along with adults, are kids prone to kidney stones?
Yes, they do. But what we see is in adults, generally there is a problem with their lifestyle, diet style.
Got it.
So, children, it is not so.
Children, it is not so. Hmm.
Generally, we find some sort of metabolic problem in their body,
Got it.
and then we can pick up.
Mm-hmm.
So, overall, another, because you asked, there is another significant area where people form stones, especially in children and adults also.
Got it.
Something like hyperparathyroidisms.
Mm-hmm.
The calcium oxalate stones form in that.
Got it.
What is hyperparathyroidism? We know thyroid.
Yes.
So a thyroid, every one of us know that thyroid is
Yes.
here,
Yes.
and there is it's like a bow type,
Mm-hmm.
and behind that there are four small pea-sized structures.
Yes. Yes.
That's called parathyroid.
Got it.
It's a gland which produces parathormone,
Hmm.
which manages the calcium metabolism of the body.
Got it.
When that gets dysregulated,
Mm-hmm.
it gets enlarged, then there is a high calcium in the body,
Right.
stones form there.
Right. Correct.
So this is one of the reasons we need to be very cautious about.
Got it.
Whenever there is a high calcium, when we do the first time testing for the stones,
Mm-hmm.
we do calcium levels, uric acid levels,
Got it.
kidney function like creatinine,
Mm-hmm.
urine analysis. That's the first timers.
Yes.
And when we pick up some sort of calcium abnormalities, then we do the hormonal analysis.
Okay.
And for recurrent stone formers, we do additional testings like 24-hour urinary metabolic stone profile.
Okay.
So they take about 2 cans. One is having an acidic acid in the can, and another is a non-plain can.
Okay.
And they collect 24 hours of urine,
Got it.
and then analyze for various levels of urinary calcium, urinary oxalate,
Right.
phosphorus, citrate, like this.
Got it. Got it. Just out of the box question, sir. Normally, anyone if has any pain, so normally people have a tendency to pop up the painkillers or steroids or maybe ongoing long-term medications are also going on. So does that also affect our kidneys?
Pain for any reason, that first needs relief. I would not say that people should not take painkiller,
Right.
but definitely there are safe medications
Got it.
one should take,
Mm-hmm.
because it's not only for the stones, it damages kidneys.
Right.
Long-term pain medications.
Correct.
But we need to address the pain
Mm-hmm.
and then treat accordingly there.
Okay. Got it.
Because you brought the medication, there are a good amount of common medications people take, and
Yes.
they do cause stones.
Right. Correct.
So, like we should know, the steroids, what you mentioned,
Yes.
the glucocorticoids, definitely yes.
Okay.
And other common medications like Lasix, people know the diuretic, where
Yes.
people take to remove the fluid from the
Fluid
body.
from the body. Correct.
So they do have a stone tendency there.
Right.
And other common antibiotics like ciprofloxacin,
Mm-hmm.
It's very common thing people take.
Got it.
They do form stones.
Form stones.
And third generation cephalosporin medications are there, something like ceftriaxone.
Mm-hmm.
They do form stones.
Right. Correct.
Like that, there are a good number. There is another Ceptron, people know. Very common medications. It's most of the people know. The another stone prone medication there.
Yes.
Like that, there are some medications which are given for eye,
Mm-hmm.
they can have.
Okay.
So it's very, very important. The medications which you take, we should not be in long term.
Correct.
Other common thing, vitamin C.
Mm-hmm.
Vitamin C on a long term can form stones.
Oh.
On a long term.
Okay.
Soluble vitamin C is about 91 milligram per day.
Mm-hmm.
So, but the vitamin C 500 BD is generally given for a therapeutic, for a short course.
Got it.
On a long term, when somebody takes,
Hmm.
yes, it can form stone.
Okay. Okay. Are there any chances of recurrences in formation of kidney stone again once he is operated or anything?
Yes, definitely. As I said, first year about 10%,
Mm-hmm.
in 5 years 30%, and in about 10 years 70%.
Got it.
And lifetime risk is definitely there.
Okay.
So if you look at somebody's born male, their lifetime risk about 20% of them form stones.
Yes.
The women have a slight advantage of they're about 8%
Got
in
it.
their lifetime they form
Right.
stones.
Correct.
So yes, recurrence is always there unless we address the primary cause.
Right.
Sometimes if you're in a stone belt, it is seen that you move out of that. That's one of the important thing. So people stop forming stones.
Absolutely. Absolutely.
That's one of the very important factor.
Right.
And nowadays the treatments are based on the micro-invasive treatments,
Mhm.
minimally invasive treatments.
Right.
So tendency of residual dust could remain somewhere.
Hmm.
So they do form a nidus, a crystal on which the stone can grow.
Okay.
So that's also important that we see that the stone
Correct.
clearance is good.
Right. Correct. So, what are the tips you need to share for our listeners regarding the kidney stones prevention?
The most important thing is the fluid intake.
Got it.
See, the urine color should be like water.
Got it.
That's the most important thing.
Mm-hmm.
And one should take milk.
Hmm.
Um, the non-preservative foods,
Got it.
um, animal protein specifically,
Mm-hmm.
and even in the vegetarian proteins, soybean to be avoided.
Got it.
Soybean has got 40% protein,
Okay.
and especially soya chunks have nothing there in that.
Oh.
So that needs to be completely avoided.
Okay.
And we have other chenna, rajma, chole.
Mm-hmm.
They are about 25% protein in that.
Got it.
Not to be consumed too much,
Okay.
maybe once a week.
Mm-hmm.
So these are a couple of simple things one can follow that. And preservative food is the one which is the most important cause nowadays,
Right.
which is forming the stones.
Got it.
And high salted foods.
Hmm.
So high sodium foods, any preservative has high sodiums,
Got
they
it.
can cause stones.
Okay. Okay.
And with regard to the, because you asked what are the tips,
Hmm.
stone disease is very common, and health checkup is a part of our routine. It should become, and one cannot neglect health in the name of devotion.
Got it.
It's very, very important.
Hmm.
And when we find a stone, I'm not saying one pathy is better than the other. Every pathy has got its own benefits.
Got it.
So, bottom line remains that how do we remove the stone? How do we remain stone free?
Mm-hmm.
So, people continue to just avoid stones which are in the ureter
Hmm.
by taking the medications,
Got it.
and which are harming the kidneys.
Got it.
So, it is the studies have shown that a stone blocked in the ureter
Hmm.
should be removed within a month.
Okay.
After a month, there is a irreversible damage to the kidney.
Oh.
So you cannot wait on, okay, continue to take some medications,
Got it.
liquids.
Yeah. So, dear devotees, we'll take a break for a minute. In the meantime, you can drop your questions in the comment section, and will join us soon. Thank you for your patience and welcome back. Now we'll talk about the treatment and management part, sir. Uh, what are the treatment options available for kidney stones, and how does one determine the best approach?
Yes. So when somebody is diagnosed of a kidney stone,
Mhm.
usually it is by sonography.
Okay.
So once sonography suggests a kidney stone, we need to confirm by another imaging, like a CT scan. The reason being, sonography is a complementary, but it is not a confirmatory in the sense with regard to the size,
Mm-hmm.
um, and with regard to the density is not known.
Got it.
It's very important that we confirm by CT scan
Mm-hmm.
and then do the treatment.
Okay.
So in the CT scan, it tells us the density of the stone,
Mm-hmm.
location of the stone, three-dimensional volume of the stone,
Got it.
and some things which are not picked up by the sonography,
Mm-hmm.
and kidney anatomy.
Okay.
We get a complete path so that we can plan the treatment for the stones.
Okay. Okay. Got it.
So in general, the treatment for the stones would go like this:
Mm-hmm.
just medications, yes, small stones,
Got it.
which could be managed with the medications.
Mm-hmm.
There are medications, for example, calcium oxalate stones.
Right.
We can give medications to flush out the stones,
Mm-hmm.
which is about 5 or 6 stones.
Right.
So, thiazide medications can be given for them.
Mm-hmm.
They do work well.
Okay.
And the other medications, for example, for uric acid stones,
Mm-hmm.
medicine to convert the urine from acidic to alkaline,
Okay.
that dissolves uric acid in the kidney.
Okay.
That works wonders.
Okay.
And another very important, the inhibitors which are less in them,
Mm-hmm.
which is potassium and magnesium,
Okay.
and citrate which is low.
Got it.
So a potassium magnesium citrate
Mm-hmm.
can be given as a syrup.
Got it.
It helps in reduction. It helps in prevention of growth of the stones.
Got it.
This is a medical treatment when you're talking about,
Got it.
right? But when things are not successful, or maybe if the stones are slightly bigger in size,
Hmm.
so we have other options.
Hmm.
Another option is, people talk as laser, but that is
Right.
not laser. Extracorporeal shockwave lithotripsy,
Okay.
where a treatment is given by machine, where the person is placed on a couch, and then waves are focused onto the stone and they are crushed from outside.
Okay.
It's about 1 hour treatment, and
Mhm.
the stones, after getting powdered,
Mhm.
they passes through the natural orifice.
Okay.
So that is the next step. And what are the indications for that? Small stones, maybe up to 1 centimeter, sometimes at 1.5
Got it.
centimeter, and the kidney stones
Okay.
possible in that.
Mhm.
And then, if the stones are still bigger, or if they are in the ureter,
Mhm.
ureter means a tube connecting the kidney to the bladder.
Yes.
So generally they are symptomatic.
Mhm.
They becomes a semi-emergency after giving the pain treatment.
Got it.
We need to go and intervene.
Okay.
So we go through the urine passage.
Mhm.
We through the urethra, we enter the bladder, and we enter the ureter. We got very nice miniature scopes, and we go and directly powder the stone with the laser.
Okay.
So laser means it's an energy source to powder the stone.
Okay.
It's it's not an any instrument to go. No, it's a energy source to powder the stone.
Okay.
So we can use laser and powder the stones.
Mhm.
Or sometimes the stones are slightly bigger in the kidney, 2 centimeter and plus.
Okay.
Sometimes they are completely filling the kidney.
Got it.
So the treatment for that is a keyhole operation from behind into the kidney, which
Okay.
we commonly call as percutaneous nephrolithotomy,
Okay.
PCNL.
Okay.
So again, that's little, as we are going minimal invasive to higher.
Higher.
So that is the one.
Okay.
And the last one is the open operation. Open operation is hardly done now,
Mhm.
unless if there is some corrective pathology to be done on the kidney.
Got it.
So these are the general overview for the treatment
Okay. Okay.
purposes. But it all depends upon the type of the stone,
Got it.
renal function,
Mhm.
so and so.
Okay. So we have one question from our participants, like, what's the basic precautions one should take if anyone has a single kidney, including food?
Okay. Single kidney, 5,000 out of 5,000, 1 person is born with the single kidney.
Yes.
And we donate kidneys to others.
Correct.
So one kidney is enough if it is normal to
Mm-hmm.
sustain our life,
Got it.
right? Whether it is one kidney or two kidneys. So the dietary precautions, the lifestyle precautions are the same.
Okay.
That's very, very important. But
Okay.
at the same time, one kidney means the overall the filter mass
Mm-hmm.
is less, half.
Okay. Okay.
So we need to be little more careful on that.
Careful. Right.
So our weight should be maintained. Most important thing.
Mm-hmm.
Where now I'm going to talk about the metabolic syndrome,
Mm-hmm.
where the overweight, called as obesity,
Mm-hmm.
the hypertension, the diabetes, genital problems, stones,
Okay.
they form a package.
Right.
If somebody has got two of them,
Mm-hmm.
rest three comes free.
Right.
And the treatment in this most commonly is by reducing the weight.
By reducing the weight. Okay.
Most important thing here.
Okay. Right.
So single kidney means it's even more important
Right.
that we maintain that our blood pressure is good,
Mm-hmm.
our sugar levels are good,
Right.
right? So our hydration is good.
Right.
That's how we need to look at that.
Right. So we emphasize the participants to more do the regular routine checkups of their health, of course. Uh, so we can take the next question as are there any chance of recurrence of stones in kidney transplant case?
In kidney transplant case, that means um, in the recipient, the person
Yes.
who has received kidney.
Yes.
Yes, definitely, it is possible.
Mm-hmm.
And reason being the same factors again.
Right.
So another important factor for stones is infection.
Mm-hmm.
So people undermine nowadays, although it has come down, but it is significant in India.
Got it.
In fact, about 2 3 decades back, infection due to stones was one of the top killers. due
Right.
to stone disease.
Yes.
So when somebody in the transplant kidney is forming stones,
Mhm.
one of the things important we should see is the infection
Infection.
are
True.
there, because they're immunocompromised.
Yes.
So that could be one of the reasons for
Mhm.
them to form stones.
Okay.
And then the weight again, we need to look at that metabolic syndrome. Is he forming anything?
Right.
The second part is that whether the donor
Mhm.
he had any stone tendency in the kidneys.
Of course.
What the advances, what has formed, what has happened in the treatment
Hmm.
is not equally happened in the form of identifying and prevention,
Got it.
right? So it's very very important that we need to see what was the donor kidney status.
Mhm. Got it. What is polycystic kidney disease?
Polycystic kidney disease.
Yeah.
It simply means the kidney has got multiple cysts,
Mhm.
and these cysts form in both the kidneys or sometimes one kidney.
Mhm.
And somebody um, who does the health checkup
Hmm.
beyond the age of 50,
Okay.
90% of the times have stone the cysts.
Okay.
So they are very simple cysts in the sense fluid is very clear inside and the lining is clear.
Yes.
So nothing to worry about them.
Okay.
But there are some polycystic kidney disease
Mhm.
which runs in the families,
Okay.
which we call as ADBKD. So they run only in the male members,
Okay.
and they do give trouble.
Mhm.
They cause renal failures,
Mhm.
and one day ultimately they come for transplant.
Oh. Okay.
So per se, if you ask me, cystic disease of the kidney,
Mhm.
they are the multiple simple cysts,
Mhm.
but there are a separate entity of ADPKDs
Got it.
and some other cystic disorders.
Right. Correct.
But cysts, as I said, simple. There are about 95% of them,
Mhm.
but 5% of them come to the complex. There are four types of cysts.
Hmm.
The simple being the commonest.
Right.
Type 2, type 3, type 4.
Hmm.
Type 4 has got some solid stuff.
Right.
That's almost like a cancer that needs to be removed.
Okay.
Type 3 is a borderline, and type 2 is a density, the thickness of the fluid inside is slightly different.
Got it.
That needs a follow.
Okay.
So per se, where somebody hears cyst, if it is simple cyst, not to worry about that.
Okay. Okay. Right. A lot of questions are coming again with terms of what are the food precautions to be taken who have kidney stones.
Taking meal on time, proper hydration,
Yeah.
and main thing is about the preservative foods. Why I'm again stressing this point is that we need to take the foods as organic as possible, because even when you take any turmeric powder, what we get commercially
Hmm.
doesn't have the curcumin what is supposed to have.
Got it.
So it is all processed. Chili powders, any masala powders what you take, they all
Mhm.
got preservatives there.
Okay.
So that's one important aspect with regards to food.
Mhm.
The way we consume, the way we honor them is also very important there.
Right.
So we rush, we have that, and for example, in doctor's life, so on the move,
Hmm.
they have it,
Right.
and other professionals, while driving in the car, they grab something, they eat something, and go.
Right.
Other extreme is that people completely avoid all this complete milk, calciums.
Hmm.
So they do form
Got it.
different group.
Right. Correct.
So what is important is the fluid intake
Mhm.
and the foodstuffs which are sattvic
Okay.
to be taken, and less oily, less masala,
Hmm.
and which puts us to a proper sleep
Got it.
at night.
Yeah. Other question we have, like one of our devotee has mentioned one question. 9 stones got detected. One was removed through laser, 8 stones are still left. Coming week, I have a review stent placed in my left kidney. 28th review and plan for next procedure. Please advise the best diet for devotees.
Well, if the doctor had removed a stone, then it is possible that stone should be sent for analysis.
Mhm.
We can get what is the type of stone, what is the combination.
Got it.
So most of the times the mixture of uric acid and the calcium oxalates,
Mhm.
because uric acid forms a nidus.
Right,
Over that cementing happens with the calcium oxalates.
right.
The stone analysis definitely plays an important role.
Mhm.
So if they have got the stone removed, if it is available with them, they can send it for testing.
Okay.
So based on that, the as I said, focusing on the oxalate and the focusing on the uric acid,
Hmm.
they should take the diet accordingly. There.
Right, right.
So uric acid stones form because of the body breakdown.
Got it.
Excessive body breakdown, athletes, people going for gym for bodybuildings.
Hmm.
Whenever we go for a gym for a bodybuilding, what happens? There is a breaking of muscles and making.
Got it.
So there is a catabolism, then anabolism.
Hmm.
So whenever that happens, there is a breakdown and break and make.
Right.
Then when there is a break, there is a lot of purine generated, proteins which degrade into that,
Hmm.
and then the uric acid, and then they form the nidus, and on that cementing happens there.
Okay.
On the top, they also take supplements.
Right. Correct.
So again, preservatives, high
Yes.
proteins.
Yes.
It's been proven now. So fitness is important, not the bodybuilding.
Correct. Right. Other question we have. My one kidney is smaller than other. Is that a concern?
What is the reason for being small? As long as the kidney function is normal,
Uh-huh.
so we need not worry about that.
Okay. Other question is: are females more prone to stones than male? If females are pregnant, then they have stones. What they should do?
Okay. So statistics say less than 40 years, the male get more stones.
Hmm.
But after the age of 40, the incidence is same
Okay.
in both the genders.
Hmm.
But yes, what you said, whether the pregnant women can have stones,
Right.
yes, they
Yes.
do can form stones,
Hmm.
and it's a challenging to diagnose those situations.
Hmm.
It comes as a special situation,
Hmm.
and we do minimal treatment
Got.
and try to, if it is giving pain, we put a stent for them,
Mm-hmm.
and then at the end of the pregnancy, after the delivery, we deal with the stone.
Okay. Right. Other question we have: my 8-year-old daughter has stones. What could be the reason?
Yes, we need to get complete checkup.
Mm-hmm.
uh, as I said, the calcium, phosphorus, uric acid levels, and the creatinine urine analysis,
Yes.
and parathyroid hormones,
Hmm.
and sonography they would have already done,
Right.
and a CT scan to be done to see whether there is any spongy kidneys there,
Hmm.
any nephrocalcinosis there, because we are looking here for a metabolic reason for them to form stones,
Mhm.
because children behave in a different way. The reasons are different, and not only that, we should do the 24-hour urinary metabolic profile, looking at measurements of urinary calcium, phosphorus, urinary oxalate, uric acid, citrate
Hmm.
levels. These five things should be measured,
Okay.
and we're trying to find out what could be the reason.
Got it.
So, apart from this, we need to look at the dietary pattern, and
Of
it is also
course.
seen sometimes somebody preterm.
Yeah.
They tend to have slightly hypercalciuria. That means more calcium excreted into the kidneys.
Right.
They have tendency for to form stones.
Right.
So we need to be a little more cautious on somebody who are small when they're born.
Got it.
So um, when we remove the stone, then we need to send it for analysis
Mm-hmm.
and then take it from there.
Okay.
And as far as the treatment with regards to the fluids,
Hmm.
child should be encouraged to take good amount
Good
of
amount of
fluids
water.
and monitor the urine.
Yes, yes,
Most
absolutely.
important thing, and
Yes,
avoid all junk food.
right.
So it's a commonest thing.
Absolutely. So other question we have, is barley water good for kidney stones? How much liter one should take in a day?
Barley water is like any other water, so definitely good for stones because it hydrates us.
Yes.
So there is no scientific proof that barley water has helped.
Okay.
So it is the clear water
Mm-hmm.
which has helped.
Right.
So because you mentioned barley water, people have so many other excuses like taking
Yes.
beer,
Yes.
right? It's a
Correct.
common thing.
Right.
So again, it's all myth.
Mm-hmm.
So, but we don't discourage somebody wants to take barley water because that is adding
Got it.
a liquid intake per day.
Mm-hmm.
So that helps in people taking that.
Got it.
So if you ask whether barley water prevents stones,
Hmm.
there is no proof, but it definitely hydrates more.
Correct. Other question is quite relatable to us. In Iskon Prasad, it is very rich with sweets. So will it affect my kidney because HbA1c is 6.2?
See, metabolic diseases which affect the kidneys are diabetes,
Mm-hmm.
hypertension. One thing I touched was hyperparathyroidism,
Right.
gout. So somebody taking a rich diet, yes, definitely. So it all depends upon what is our metabolism status.
Hmm.
So our physical activity is not as much as it used to be.
Okay.
Our diet is too rich.
Correct.
So we need to monitor. We need to take whatever is necessary for us.
Right. Correct. Correct. True. Other question we have, any specific vegetable or fruits is to be avoided for stone formation? What should be the limit of sodium and other minerals level drinking water?
So drinking water is a clear, pure water is enough.
Got it.
There's nothing like what type of water need to take.
Hmm.
So the clean water is what is recommended,
Mm-hmm.
and how much is the urine color.
Got it.
So there is nothing like so much liters to be taken.
Okay.
So with regard to the other aspects
Mm-hmm.
like sodium, it is better to minimize sodium intake
Mm-hmm.
as much as possible because scientifically proven ones are high sodium
Hmm.
and high animal protein,
Okay.
very clearly mentioned as a lithogenic factors.
Right.
We need to avoid that.
Okay.
That's most important thing.
Hmm.
What was the other thing?
The other thing was the specific vegetables or fruits to be
Yes,
avoided.
to be avoided there.
Yes.
Um, fruits to be taken as a wholesome. Why I'm saying there is nothing like avoiding for stones.
Mm-hmm.
Fruits to be taken as a wholesome,
Got it.
not the fruit juice.
Mm-hmm.
Fruit juice has got nothing but sugar
Okay.
in that.
Right.
So
Yes.
when you take fiber, there is a good bowel motion.
Mm-hmm.
When the bowels clear, there is a less amount of oxalate retention in the body,
Okay.
and it indirectly helps in lowering or completely preventing calcium oxalate
Yes.
stones.
Right.
So all fruits are good in wholesome.
Mm-hmm.
Unless somebody has got diabetes, somebody has got allergies to something, that's a different story.
Correct.
But there is nothing like we need to avoid something.
Okay.
But somebody who's got a renal problem, they
Hmm.
may avoid potassium-rich foods
Hmm.
like banana.
Okay.
So apart from that, all fruits are good.
Okay. Got it.
So with regard to the vegetables, the spinach people talk about,
Mm-hmm.
yes, it's a lot of good things in that, fiber, iron, but it has got oxalate,
Oxalate.
quite rich in
Okay.
oxalate.
Correct.
But how is it helpful? We should take palak paneer. That is how it is supposed to be made, where it gets neutralized.
Right. Right.
So otherwise, we can take the people talk about the seeded fruits,
Mm-hmm.
seeded vegetables,
Correct.
tomato, brinjal, bendi.
Ladies finger. Yeah, Wendy.
So all these are not proven,
Mm-hmm.
and they can be consumed.
Got it. Other question we have. I have prostatitis and have gut issue, and bowel movements are not good. Can it be the reason for stones, or will this situation lead to stones?
Definitely possible there. So there is a completely different one entity where absorption disorders causing stones.
Got it.
They form calcium oxalate stones.
Hmm.
It's very important that our bowel is clear. There could be various reasons for that.
Hmm.
Whichever way, we need to make sure that our bowels empty properly.
Okay.
Dietary precautions, the time to sleep,
Hmm.
and the physical activity what we do, medical support what we take.
Got it.
We need to take whichever path is whatever,
Hmm.
but we need to make sure that our bowel is empty.
Okay. Correct. Is varicose and stones correlated?
Is it
Varicose and stones correlated?
varicocele? You meant to say?
Yes.
There is no correlation as
There is no
such.
correlation
No,
as
both are
such. Okay.
different diseases as such.
Okay.
So varicocele is what? It's a disease where the testicular veins are engorged.
Mm-hmm.
They're not draining properly.
Got it.
So that has got no relation with the stones.
Okay. Okay. Right. So I think we have almost all the questions on the diet aspect because everyone is asking the same questions. So requesting participants again to drop down their comments because we have a very time limited to us. So if your queries and questions are being unanswered, definitely we'll look forward to answer those in the comment section as well. Apart from that, the devotees or any other participants who have joined us, what is the last tips you will give to them with terms of dietary aspect as well?
So now the it's all about devotees.
Yeah.
We know all devotees are taking sattvic foods.
Yes.
So in that sattvic, even in the prasadam, when we are taking,
Mm-hmm.
it's important that each one of us is different.
Right.
Ayurveda talks about different prakriti, and then got so it is very important that we consume food what is appropriate for us.
Got it.
Most important thing.
Right.
We take a proper liquid. We
Mhm.
hydrate ourselves, and we take milk, and avoid all junk foods,
Mhm.
especially we go to various places, even for our devotee circle we have pasta, pizza, so many things, the rich in cheese, rich
Yes.
in even in the plant proteins, they're all quite rich.
Got it.
Somebody occasionally, yes,
Mm-hmm.
that's one enjoyment all of us have,
Of course.
but if it is a constant,
Yeah.
it is not nice.
Right. Correct.
So, in the name of Prashadam, anything Atyahara taking more
Mm-hmm.
definitely leads to this disease.
Got it.
It's directly, indirectly,
Mm-hmm.
because it predisposes us to put on weight,
Mm-hmm.
it predisposes us to develop hypertension
Got it.
and diabetes.
Of
Every
course.
third person is a diabetic in India now.
Very true.
So, it's all about diet. Prashadam, yes, Prashadam, but we need to make sure what is good for us.
Got it. Right.
So, as sattvic as possible.
Mm-hmm.
So devotees no need to mention. Whatever need to be avoided, I had already mentioned.
Right. Correct.
So those things to be just followed.
Of course. Of course. We'll take the last question, sir. Gallbladder was been removed in 2008, like past couple of years back. What precautions should I take to maintain a good health?
Gallbladder has no direct correlation with
With
the
kidney.
urinary stones.
Yes. Right.
That is generally dealt by the general surgeon.
Yeah.
And somebody's gallbladder is removed,
Mm-hmm.
again, fatty stuff to be avoided, putting
Correct.
on weight to be avoided.
Right.
So anything, it's very common nowadays we find fatty livers.
Right.
What is fatty liver? It is all extra unwanted things goes and get deposited there.
Yes.
It's a part of metabolic syndrome.
Mm-hmm.
So somebody's gallbladder is also removed. It's very, very important, the maintenance of the weight and the diet and the
Yes.
healthy habits.
Right. True.
No preservative food,
Correct.
organic food. to be
Correct,
taken.
correct, correct, right. Uh, okay. So, due to the time constraints, I think we need to end our podcast definitely here. So I thank our today's speaker, our streaming partners, Hare Krishna YouTube channel, and of course you all the participants who are joining for this today's podcast. We will definitely get back to you with another health topic very soon. Till then, stay fit, stay active, and of course, take care of your kidney. Hare Krishna.
Hare Krishna.